Hey everybody, welcome! Today we're going to do some Gua Sha for the calves. This can really help conditions like plantar fasciitis. It's going to help pain in the feet and the ankle. And if you want to know more about Gua Sha, you can watch some of my other videos, but in a nutshell, what it does for you is it helps release fascial adhesions. Fascia is the connective tissue underneath your skin, and it wraps around your muscles and it connects the entire body together, and it's really important to keep healthy. So what happens is there are certain areas in the calf that it can get stuck, and it makes the muscles stick together so that they can't function independently like they want to. And so what Gua Sha does is it goes in and physically breaks up those fascial adhesions. You can watch one of the videos that I post above if you want to learn more about that, but I want to talk about what I'm doing here. So I'm using my handlebar steel tool to really access that calf. It really does a good job on getting the whole muscle all at once. If you're using a handheld tool, you might have to angle yourself a little bit differently, but it will still get the job done. So what you're going to be doing while you're scraping is you're going to be feeling for these areas where it doesn't feel smooth anymore. It will stop your tool, and you might even feel sort of a grainy feeling, which is what Gua Sha is. Gua, to scrape, sand. So it will feel like sand. Now there's always a few spots in the body that get stuck on everybody, and those areas that the picture is pointing to are where you'll find them in the calf. So if you focus your Gua Sha on those areas, it will do a lot of good. And also up higher, kind of right behind the knee, is the other spot that you can focus on. If you go ahead and touch your leg bone and go right behind it, that is where I would focus most of my attention when I'm working on these muscles. It's kind of a weird thing in our bodies, but we usually feel pain outside of the area that is the problem. So, for example, like when people have plantar fasciitis, a lot of times, yeah, some of the stuff and the adhesions are down in the foot, but most of the time the problem is up in the calf. If you are someone who experiences ankle sprains or chronic ankle sprains in this area, I would definitely focus on the peroneals, which are where I'm working right now, because once you've sprained your ankle, those muscles tighten up to protect it and help hold it stable, and they can just become stuck to all the other muscles around it. And working on the tendons and the ligaments down below can reduce inflammation in the area and bring fresh healing to an ankle sprain or some other sort of trauma to the area that has been around for a while. I definitely wouldn't do this if it was acute or recent. So if it was, within the last 2 weeks, I probably would not go to scraping yet as it needs healing. But I would do it more if it has been sticking around for a while. Okay, so now I'm focusing more on the inside of the calf, as you can see. And that area right underneath your leg bone or your tibia is going to be the perfect area to do your scraping. If you have plantar fasciitis, that area that I'm working right now, that little indentation, is going to be your money spot. So make sure that you focus on that area. You will probably feel some pain as you're working there, but just pull down and away from the tibia and help, and just kind of go in different directions in that little spot. And that will help release the soleus from the gastrocnemius. And I would also go up a little bit higher, kind of more towards the knee, and focus your area on that. You can usually tell where your body needs it because it will hurt there. Remember, less is more. You don't want to create a whole bunch of trauma and make it super sore for the next week. So try doing it in stages. So after you felt like it's starting to get sore, after you're working on it, go ahead and give it a break for a few days and then get back to it. You will be amazed on how quickly it feels better and how much it improves. And just make sure that when you're done, always use a little bit of massage to help move some of that metabolic waste that's been trapped, and also to help push fresh blood to the area. You can definitely spend some time on the tops of your feet. Now, you just never know where your fascial adhesions are, and they're kind of like snags in a t-shirt. They can pull the fascia in other areas, so just addressing all the areas of the body is always going to be a good thing. This is why I love this tool in particular, this little fish-shaped tool, because you can access all the tendons and ligaments and your toes. Now moving to the bottom of feet, this is where you're really going to find a lot of progress. You really need to make sure that you warm this area up first. And I talk about how you can do that in other videos. I'll link to one above. But you'll feel like a thick tissue right here. It will feel not smooth, but it will kind of stop your tool. And those are the areas that you want to focus on, especially here in the arch. If you have plantar fasciitis, a lot of times people feel it here and not so much in the heel. So a few years ago, I had plantar fasciitis, and I would work on this area every other day for a few minutes. Not trying to just hammer it all at once, but definitely trying to be consistent about it. And it is gone. It has not come back, and that's what I love about Gua Sha. Just go in there every day or every other day and work on it, and it will not come back. A lot of times when we just use massage in these areas, they tend to go right back, but when you're breaking up the fascial adhesions, that helps you get rid of the chronic problem. All right, well, thank you for watching, and make sure that you check out my other videos if you want to see how to do Gua Sha in other areas of the body, or to just watch massage techniques. Make sure that you subscribe below and comment, and thank you.